Hi, my name is Kirk Hamilton, your host of the Staying Healthy Today show. Today's show topic is Alzheimer's disease, neurologic and psychiatric disorders, COVID-19, and mRNA injections, and the benefit of the lithium orotate. And this is a review of an interview that actually Tucker Carlson did on July 3rd with a Dr. Michael Nehls, MD, PhD. He's a molecular geneticist, and it was exceptional because it connected several things I've been talking about lately, including Alzheimer's disease and neurodegeneration, along with the real dangers of the mRNA injections and COVID. And so I just decided to review this, and the link will be up there to Tucker Carlson's interview with him. It's got an amazing amount of hits already. The reason it's so relevant to me is that I have done in the past month or so two interviews on Alzheimer's disease. One is with Dr. John Lewis. He's a researcher who, for the last 20 years or so, has studied an allopolymannose dietary supplement. It has about six other entities in it: rice bran, flaxseed, a few other things, that in a very controlled study of um, moderate to severe Alzheimer's patients, it improved cognitive function over a year quite remarkably. So that was one element. And then the other was within the last month, I interviewed Dr. Dale Bredesen, a very world-renowned neurologist on treating Alzheimer's disease and cognitive decline. It was called Precision Medicine in Treating Alzheimer's Disease. And he has seven basic things that you do. The five basic lifestyle things are, diet, low glycemic diet, sometimes a modified ketogenic diet, but it has to be whole foods, lots of plant-based materials, but animal protein as well. Then you have aggressive exercise, stimulates BDNF, brain-derived neurotrophic factor that helps build new neurons. And we're going to talk about that a little bit in Dr. Nehls' interview. Sleep, where you consolidate memory, when the microglia kind of clean up and clean house, so to speak. Good stress, good brain challenge, and then avoiding overwhelming stress. And then the two other things in Dr. Bredesen's approach are to deal with infections and environmental toxins. So those were two things fresh on my mind. And then the other thing that was fresh in my mind is recently I reviewed in my last health letter the permanent subcommittee on investigations, and I reviewed five or six of the experts that gave testimony, and two of them were Dr. Angus Dalglish. He's an oncologist from the United Kingdom, and he talked about the mRNA injection as a cause of cancer and more progressive cancers, more lethal cancers. And then there was Asim Malhotra, both from the United Kingdom, cardiologist, was a big proponent of the mRNA vaccine, and now he is just the opposite, and he believes it can increase the risk of vascular disease significantly. So the reason I put those all two together, and there'll be links belowhand, is that Tucker Carlson has interviewed Dr. Michael Nehls before, but he interviewed him this time on secret cure to Alzheimer's, depression, anxiety, and why Big Pharma has kept it hidden. And so I started to listen to this, and he's very strong on one, emphasizing obviously that lithium orotate in particular can have a dramatic effect on improving neurogenesis in the hippocampus and improving Alzheimer's disease and cognition. But secondly, he actually starts off this discussion and interview talking about the messenger RNA injection and the spike protein and how destructive it is to neurocognition. And he believes it is a cause, and actually cites a South Korean study which supports this. So they all kind of came together. And the reason that I have brought in the people from the last podcast that I did, or summary, is that these messenger RNA vaccines are still out there. They're not taken off the market. These world-class experts, not American physicians, I mean, there are many, but these happen to be foreign physicians who have spoken all over the world, are calling for the removal of these vaccines. And they're talking about the leading causes of death: cancer, heart disease, and neurodegenerative disease, especially Alzheimer's disease. And they keep bringing up the messenger RNA injection. So I put links to those on the front page, but I'd like to get into uh, what the interview was about, give you an overview. I encourage you all to listen to it. It's an hour and 24 minutes. I always turn it up to 2.0 speed or 1.75 and cruise through it. But I actually did this one 3 times because there were so many connecting things. In that regard, let's get going. So the title was The Secret Cure to Alzheimer's, Depression, Anxiety, and Why Big Pharma Has Kept It Hidden. And this was again on July 3rd, 2026. Tucker Carlson interviewed Michael Nehls, MD, PhD, and I guess he's done that before. And Michael Nehls is a molecular geneticist as well as a physician, and he has done independent research and he does writing. He has several books, which we'll go over at the end. He starts off by talking about oxytocin release, and that's where the companionship with a dog comes from. And Tucker Carlson is a big dog fan, and it turns out that oxytocin can help regenerate neurons. I'll bring it in the context of not only pets but also a mother and her child. There's a secretion of oxytocin during delivery, but also it's known as the kind of love medicine or the love hormone. And and after intercourse, it's secreted. And so oxytocin, with the relationship between the mother and the child, can help neurogenesis for both. So that was how it kind of started. And he talked about lithium being essential for all life on the planet, not just humans, but all life on the planet. And he goes into the history of that. And then his theory um, of yeah, in 2016, he wrote an article on kind of an inclusive theory of Alzheimer's disease. And part of that is obviously hippocampal atrophy. The hippocampus is the part of the brain where memory is involved, and the larger the hippocampus and the more healthy cells, neurons, the better off you are with your memory. So he talks about how lithium can affect and benefit neurogenesis in the hippocampus. And then one of the reasons, and this is where he got connected as he talked about the hippocampal campus being involved in cognitive decline and Alzheimer's, and how lithium orotate benefited that, he flashed to why. And it can also help prevention of cytokines and suppress cytokines, very inflammatory compounds in the body that were noted in COVID in particular. And then he flipped over to a discussion about not only the COVID virus creating these cytokines, but also the spike protein from the mRNA injection, and even being a more significant problem. And he felt strongly that the mRNA injection increases the risk to neurocognitive decline. And obviously, he's very much against the vaccine. There's several episodes where he actually speaks at different symposia. The German Bundestag, this was in 2025. He talked specifically about SARS-CoV-2 and the vaccine being a bioweapon. And then also in an international cooperation forum in April of 2024, they actually asked him, because they knew he was going to talk about the connection between the COVID vaccine and possible ill health effects. They cut about 50% of his slides out, and he tells that little story in there. So that's where it hooked me into connecting. We're talking about lithium and Alzheimer's disease, and then he starts off this conversation with a very strong statement about the COVID the COVID virus and the COVID vaccine both being bioweapons. He mentions Ralph Barics, laboratory and where the COVID virus was created and then probably enhanced in Wuhan. And so that was a connection, and that's why I pulled it into the conversation. Alzheimer's disease, neurocognitive decline. One of the simplest things we can do is, number one, don't get any more vaccines, and two, is probably work on getting the spike protein down. Then he goes on to talk about a study. He still continued on the topic of COVID, and he talked about where they used vitamin D in its most active form in early COVID, and it prevented ICU admits and dramatically. And he felt that very strongly that the use of vitamin D, along with lithium, would have been beneficial in COVID in treatment. So we'll move off of the COVID vaccine, but there's a big section in there on that, and continue with him speaking about lithium. So lithium is a trace element that's important for all life, and it stimulates neurogenesis. He talks about lithium stimulating brain-derived neurotrophic factor, which you've heard me talk about before, especially with exercise. And lithium also stimulates autophagy, and it helps with fasting when you're trying to improve neurocognition. Then he summarizes the rationale for using lithium orotate, because there's many other forms. There's different salts of lithium, but he uses orotic acid because it crosses the blood-brain barrier more efficiently, delivers lithium to neurons more efficiently, allows for very low physiologic doses of 1 milligram per day. That's 1,000 micrograms per day. It avoids the high toxicity of psychiatric lithium doses, such as lithium carbonate. And many of the historical concerns about lithium toxicity came from using like lithium carbonate in hundreds of milligrams. So it's much safer as the orotate molecule. He discusses the original person who really brought the use of lithium into the psychiatric realm, Dr. John Cade, in a 1949 article, Lithium Salts in the Treatment of Psychotic Excitement. And he studied manic depressive patients and had remarkable benefit. And then he goes into the toxicity of lithium and the other forms and how to avoid that. And then he has a big emphasis, or a big term that he likes to use, is the law of minimum. And lithium, if my understanding is correct from his interview, is not an essential element, or it's not defined as that, even though he believes it is. And the law of minimum simply means that the biological processes of life or health, optimal health, can't continue if you don't have that one minimal nutrient. And so he believes that lithium should be an essential trace element. He has written several books: The Conspiracy Against Lithium in 2025, The Exhausted Brain in 2025, and The Algae Oil Revolution, which is the algae-based omega-3 fatty acids, and that's in 2025, and then The Indoctrinated Brain in 2023. And originally he wrote an article way back on the Unified Theory of Alzheimer's in Journal of Molecular Psychiatry. I thought this was, I have more written underneath this video, and links, but the bottom line is, for me, lithium orotate at very safe doses is another adjunctive treatment for Alzheimer's and neurocognition, because it helps build new cells, neurons in the hippocampus. He calls them index cells, and it helps enlarge the hippocampus, and that can help with cognitive decline. At the same time, it's a great cytokine inhibitor, so it could be used in COVID. And there's many other uses that he talks about, but especially in the neuropsychiatric realm. And it's something that, we can do relatively simply. So while if you go back to the precision approach of Alzheimer's disease and neurocognition, you've got those 7 steps, the exercise, the diet, the good stress, the bad stress, and toxins and infections. But now we have a product, the Daily Brain Care Formula from Dr. Lewis's work, that's a reasonable thing to do. I would say that lithium orotate, I will definitely try it in my neurocognitive patients and see how they do. And also, you have another tool to help if there is another COVID infection and also protect people. I'm going to start using it more in those who have long haul COVID or they have elevated spike protein antibodies, which continues to be a topic. So there are other links to other articles in from the last week or so, but I just wanted to put these all together because it just came together as I was driving in my car this 4th of July. The other thing I think that rings out about the 4th of July in this work is we have to be free. I mean, 4th of July is about freedom and independence of our country. And we have to remain free to be able to exchange ideas, to learn from each other, and monopolies such as big pharmaceutical companies or government associations between big pharma. We have to be free to be able to exchange ideas and to learn. And so this is a key thing that I think we're going to be going forward in the next few years to find out how well we can share information, because we got a taste of not being able to share it very well during COVID. And I think some kind of event like that will probably happen again to challenge us to be able to share and take care of ourselves. So my name is Kirk Hamilton, and I encourage you to enjoy this issue, and I encourage you to go listen to the podcast. The link is there to Tucker Carlson interviewing Dr. Nehls. I think you'll find it very enjoyable. Talk to you soon. You have a great day.